want to review the scanning procedures for you. Okay, again, we take our transducer. We start off sagittal transabdominal. Why? Transabdominal gives us the large field of view. We use the full bladder technique. Do you understand now that why we need the bladder, how that pushes away the bowel, and we're able to get perpendicular to the uterus and the ovaries? Sometimes we see them, sometimes we don't. If we don't see them, we don't worry about it. But if that bladder doesn't come up above the fundus, then it's not full enough. Or if she's at that gravida where she's got the large uterus and you're not going to be able to get the bladder over the fundus, then we're going to angle up, always using that bladder as a window. Remember then, as she gets further along, and as the uterus gets larger and extends up above the umbilicus, we really don't need the bladder, do we? Other than for the lower uterine segment, because what we want to do is document where that placenta ends, because that's important information in second trimester. And remember how I showed you that you put it down by the bladder and get a lower uterine segment, which includes the vaginal canal, the cervix, and the opening of the external os, and then you want to see where the edge of that placenta ends. That's a good picture to take, and you just mark sagittal midline, because then that physician knows that that placenta is up. Do you need to usually worry when there's low lying? Not normally, because placentas always migrate upward. So even if it's low lying, most likely with a follow-up, she's going to be okay. It's those complete placenta previas that totally cover the cervical os or marginals. They're going to want to keep an eye on it. And all you have to do as far as a referral on that is low-lying placenta or marginal placenta previa suggests follow-up, okay? But again, you're not going to be doing too many second trimesters, so as we talked about yesterday, that placenta location will not be important information for the first trimester. But why would we not have to use the bladder when we're up about 16 to 40 weeks? What do we have? We have amniotic fluid. We don't no longer have to sit there and angle through the bladder. So instead of doing the angulations like we do in early OBs and GYNs using the bladder, then our movement becomes more like this. And we bless the uterus because we want to see the fetal lie. Okay? If the baby is laying like this and we bless the uterus, what will we see? A cross-section of the inmate. Good. Perfect. So now we've established that the baby's laying transverse, and now as we go down and bless the baby transverse, we're going to see part of the baby. Let's say the baby's laying like this. We still don't have the whole head on there, do we? But we see some of the baby. So many of us go yesterday, and I noticed, how do I connect the baby? How do I get a good picture? Stay right there and just slowly angle and connect that head to the body. Then you've established lie. Okay, so we forget about mother. We see that the lie of the baby is just like this. Now to go transverse to lie of the baby, what would we do? Okay, 90 degrees, right? To this angle. We're forgetting about mother, correct? Right. So 90 degrees. Okay, baby's lying like this now. I want to start examining the baby transverse. Where would I go with my transducer to find the baby's head? You angle up toward the head. Then what's so nice, once you've established fetal lie and that baby doesn't move around too much, all it is going up and down the baby. So we see the head. This is the area we take the biparietal measurement. Do you remember the landmarks for the biparietal measurements? You did a good job of teaching them. What else? What shape should this head look like?
Round.
Kind of oval. If you're round, you're kind of not right in. It's got to be like, here's the baby's head, okay? We want it oblong. In fact, this is the perfect position if the baby's lying this way or this way to get a good BPD, because look what we're getting, right perpendicular to the angle we want. We're going to see that, folks, perfect. Now, if the baby's laying straight up, are we going to be able to get it? It's going to be very, very difficult. Or if he's laying straight down. Why? We're trying to get the head this way. How are we going to get perpendicular to the falx? We're going to get that oval shape. The other way you're going to get an oval shape if you're up too high. Completely round. I'm not saying oval, round. That will shorten the diameter, correct? And it will, mess up our gestational age. What I do when I come and I see the baby lying like this or like this, I go to further measurements and hope that the baby will move its head. If it doesn't, you do the best you can. Sometimes you have to angle up under, have the mother roll up on her side. There's different tricks you'll learn along the way. Okay, let's go back. We've got our baby. Remember, we're scanning. We've established the fetal lie here. We know that to get the head, we're up here. Now, where would I go now if I scan? What would I see next as I scan down? Good. This would be the place where you take your M mode, okay? Y'all understand how to do your M mode? Put the cursor through the M mode. And we had trouble yesterday. Isn't that weird? That machine was not being very good to us yesterday. Okay. And we take our M mode, and then when we get the rate, we stop it, and we measure the heart rate by pushing that button on the machine. Most of them are calibrated every 2, okay? You find out, and then that puts it on. Okay, now we're coming down. What's the next thing would we see? What is the area where we'd like to measure what area what would we see for good measurement of abdominal circumference?
See the stomach and the portal and train.
Mm-hmm. The umbilical vein coming in, good. If you don't see the umbilical vein, but you just see the stomach, that's good enough. Sometimes, you try to get that perfect image, and not always do you get it. So then at least you're around with the stomach. Okay, I'm going to angle down a little bit more. What am I going to find? What's between bladder and stomach? On it. Good. What will those kidneys look? Where will those kidneys be? Mm-hmm. Right on the side. What position do you think would be the best way to visualize kidneys? Both kidneys at the same time. Just
The baby's on his back.
exactly. Why? Or what's another way? Back or what?
Stomach.
Mm-hmm. Because look what happens. We see the kidney side by side next to the spine. Baby's this way, we see the spine, the kidneys in the back. When the baby's like this, will we see both kidneys? Oh, you are so good. Aren't you proud of them? I'm not even. Okay, what's after the kidneys? What if we don't see the bladder? And the baby's kidneys start to function after 11 weeks. So if we don't see bladder after 11 weeks, what would you do?
Assume they peed.
Good job. What should we do if we're going to assume the benefit of the doubt that the baby went to the bathroom, but just to be sure that the kidneys are functioning properly, what should we do?
Just note that, or just wait and try it again. Wait and try it again.
The bladder will refill again in about 10 minutes. You should start to see. So if it just emptied up, your bladder will fill up again. You only don't get to pee once a day to fill up. That baby's constantly drinking. So that's what you want to do, is see that round circle, just to make sure that you've seen it. I mean, you're not making a diagnosis, but isn't it nice to just, since you've got a hold of the baby, just to check and look? You don't even have to report it because you're doing a limited study. But it's just what I'm trying to say. It's nice to do that survey down. And then if you did see something that concerned you, you would know enough to, maybe referral, maybe not. Again, I'm giving you more information than that you need, but I know you can handle it. To get the femur length, you go transverse down through the spine, and then you're probably going to see that bright bone. And all you've got to do is just slowly move this transducer once you find that bone, and you want to get the longest end from both the epiphysis and the femoral head. So you just slowly rotate that till you get the whole femur on, okay? When you get the whole femur on, you always keep that finger on that freeze button. Always have it ready to go. Thank God for Cine. Isn't it nice that we can cheat with Cine now? Cine allows us to go back if we miss it. what we're going to do is me and the students are going to measure the baby's head and the abdominal circumference and then what we call the femur bone, the leg bone. And when we kind of average those together, it'll give us a good idea on how far along you are and if your dates are accurate and where we're at. According to this, let's see, I'm getting your head measurement at 8.0 weeks and getting you about 30. How many weeks are you supposed to be?
33.
Yeah, the abdominal circumference is coming out to 33, which is good. Let me make a picture of that. Okay, let me just take a couple more. Then what we're going to do is, this is your baby's head.
Oh my God.
And there's the baby's heart. Do you see the baby's heart moving right here? See it? See the heart? You can't see that heart. Dad, can you see that heart? Yeah. See that? Right there. This is the baby's spine and ribs. See the rib shadow? And then
Facing towards my back?
Well, your baby's head is here. So it's kind of, there's the eye. See the eye? And the little nose right here. Cute little nose there. See the nose? Which is, sometimes if you watch long enough, they'll, stick their tongue out at you or suck their thumb. And all kinds of great things. I'm trying to press on. Look at that cute nose, though. Can you see that nose sticking out? That's all right. That's so cute. See this white line right here? That's the baby's femur bone right here. And we can measure that to see how far along you are, too. Let's see if that is the femur bone. So to make sure that is the femur bone, I'm going to go right down the abdomen. How's the spine, girls? Is that spine up or down? Or how do you think that baby's lying, just from what you've seen me scan? We found the head down here, right. And as we go up, the spine is up. Okay, we're seeing the baby in the transverse plane, and I'm in transverse. So you should probably already start to establish how this baby's lying without even doing the scanning. Here's the baby's head. And students, here's the baby's head. We're establishing fetal lie. Okay, we're coming up. There's the heartbeat. And are we seeing the baby in the long axis or short axis right now? What are we looking at? Here we see the head. We see the long axis of the spine. So that tells us that the baby's lying just like this, correct? Now, there's the head. And let's see where those feet are. Let's see if I got that. Ta-da, we see some feet, right? And legs. So how is that baby lying? Okay, come on, and we'll put that baby right on that stomach. Okay, put her right on the stomach. Exactly. And this baby is about the same age as your baby in size. So this is exactly what's going on inside of you. Baby's laying with his head here, and his spine here. And do you feel yourself being kicked over here? Yep, because that's exactly how. Now, they move around still, but not as much as you get further along. And this is good because you want the baby with the head down for for delivery. So you're in a good position for delivery. Okay, now students, if we're going to go ahead and scan this baby, and he's laying like this, if we were going to get the longitudinal lie, then the transducer would be like this. Now, if we wanted to go ahead and get the transverse lie, and I want to find a head, which direction would I go down? Right. And what would be the next thing I would cut through?
Heart.
Okay.
Stomach. And kidneys.
Okay. Go ahead. Who's next?
Oh.
And now we want to hook the baby together and find the fetal eye. So we want to connect the baby's head with the spine. So what you do is, again, you're right here. Just kind of stay right here and find the spine. Just keep angling out till you find the spine. You see any spine? There's some spine, right. So now you try to connect that spine to the baby's head. So you piece that baby together. There we go. We've connected the head bone to the backbone. Is there a song that way? And now, if you freeze that, and now look down at your transducer, that's the lie of the baby. When I say that, that is how the long axis of the baby, right like that, okay? Now, to establish transverse to the baby, not the mother, how would you turn your transducer? You think that's the right way? Or this way? Right. Right. So stay right there, unfreeze. Okay, now I want you to find me the baby's head. Exactly. Keep going. Good, good, good. Okay. There you go. Now I want you to go find the baby's heart. There you go. Okay. Now go find the baby's stomach. You girls are all doing so good. Good. That's the stomach. Yeah, and how is the spine? Spine is where? Good. Up. Okay.
So this is where I'd measure if I was going to measure.
Right, but you remember how I said in class that I prefer spines to be at 3 or 9 o'clock because of that crazy shadowing we get from the spine that obliviates the umbilical vein. So I would probably wait to see if that baby turns for you to get a better one. If it doesn't, you just grab what you can get. But
you can see the baby's face here. You see? Eyes, there's the nose. See the little lips and the tip of the nose. Their little hand is folded under its mouth. There you go. Do you see the baby? Do you see the baby? Look, there's the mouth, eye, the nose. And then go down here. You can see the heart. There's the heart beating right there. Here, I see a femur. We want to measure the femur that's closest to the transducer. Oh, look, baby's moving here. There's the bladder. There's the 3-vessel cord. Now, do you see how this femur can get distorted if it's not perpendicular to the transducer and the ultrasound beam? You have a hard time getting an accurate measurement. And then we can come back up here to the face. And he moved a little bit. There we go. Okay. What is the, you see the placenta? Is the placenta anterior or is the placenta posterior? Very good. How do you know it's anterior? Very good.